Anxiety disorders. In 2019, WHO reported approximately 301 million individuals grappled with anxiety disorders, among them 58 million children and adolescents. Anxiety disorders are characterized by excessive fear and worry, leading to significant distress or impairment in daily functioning. Common types include generalized anxiety disorder, panic disorder, social anxiety disorder, and separation anxiety disorder. Effective treatments encompass psychological therapies and, when necessary, medication. Depression. According to WHO reports, depression impacts around 280 million people, including 23 million children and adolescents every year. Unlike fleeting mood swings, depression entails persistent feelings of sadness, irritability, or emptiness, accompanied by a loss of interest in activities. Symptoms may encompass poor concentration, feelings of guilt, hopelessness, suicidal ideation, changes in sleep and appetite, and low energy. Treatments include psychological therapies and medication. Bipolar disorder. Approximately 40 million people worldwide experienced bipolar disorder in 2019, characterized by alternating episodes of depression and mania. Depressive episodes entail profound sadness and diminished interest in activities, while manic episodes manifest as euphoria, increased energy, talkativeness, racing thoughts, and impulsive behavior. Management strategies include psychoeducation, stress reduction, and medication. Post-traumatic stress disorder, also known as PTSD, is prevalent in conflict-affected areas and can arise following exposure to traumatic events. Symptoms may include intrusive memories or nightmares, avoidance of reminders, and persistent feelings of heightened threat, significantly impairing daily functioning. Effective management often involves psychological treatments. Schizophrenia impacts roughly 24 million people globally, characterized by perceptual and behavioral impairments such as delusions, hallucinations, disorganized thinking, and severe agitation. Cognitive difficulties are also common. Treatment options encompass medication, psychoeducation, family interventions, and psychosocial rehabilitation. Eating disorders. In 2019, around 14 million individuals experienced eating disorders, with almost 3 million being children and adolescents. Disorders like anorexia nervosa and bulimia nervosa involve abnormal eating habits and preoccupations with body weight and shape, posing significant health risks. Treatments include family-based therapy and cognitive behavioral therapy. Disruptive behavior and dissocial disorders. Disruptive behavior and dissocial disorders affected an estimated 40 million people in 2019, encompassing conditions like conduct disorder and oppositional defiant disorder, characterized by persistent defiant, disobedient, or aggressive behaviors. Effective treatments often involve parental, caregiver, and teacher involvement, cognitive problem-solving, and social skills training. Neurodevelopmental disorders. Neurodevelopmental disorders manifest during the developmental period and encompass difficulties in intellectual, motor, language, or social functions. This category includes disorders like intellectual development disorders, autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. Treatments vary, including behavioral therapies, educational support, and sometimes medication. Obsessive-compulsive disorder, OCD. OCD is typified by persistent intrusive thoughts, obsessions, and repetitive behaviors, compulsions, often performed to alleviate anxiety, but significantly interfering with daily life. Effective treatments include cognitive behavioral therapy, CBT, and medication. Personality disorders. Personality disorders such as borderline personality disorder and antisocial personality disorder involve enduring patterns of behavior, cognition, and inner experience that deviate from cultural norms, impacting relationships, work, and self-image. Treatment typically involves psychotherapy and occasionally medication. Substance use disorders. Substance use disorders entail excessive substance use, leading to addiction and significant impairment. Treatment options include behavioral therapies, support groups, and medication-assisted treatment. Somatic symptoms and related disorders. Somatic symptom disorders involve distressing physical symptoms not fully explained by medical conditions, often coexisting with anxiety and depression. Effective treatments include cognitive behavioral therapy and medication. Sleep-wake disorders. Sleep-wake disorders, like insomnia and hypersomnia, disrupt sleep patterns, leading to daytime distress and impairment. Treatment may involve lifestyle changes, cognitive behavioral therapy for insomnia, CBTI, and medication. Neurocognitive disorders. Neurocognitive disorders, including Alzheimer's disease and other dementias, result in cognitive decline, impacting daily life and independence. While no cure exists, treatments can help manage symptoms and enhance quality of life.